Hey everyone, Dr. Mike here. Imagine waking up every morning feeling tired, even after a full night's sleep. Or noticing your vision is getting blurry for no apparent reason. Maybe you've noticed that your wounds take much longer to heal than they used to. What if I told you that these seemingly harmless symptoms could be the first signs of a silent condition affecting millions of people? A condition that, if ignored, can lead to heart attacks, strokes, amputations, and even death. This is what we need to talk about today. Diabetes. A condition that many have, few know they have, and almost nobody takes seriously enough. Stay alert. Prediabetes is sending signals to your body right now, and if you ignore them, the consequences could be fatal. What is diabetes really? First of all, let's understand what this condition is. Prediabetes is that middle stage where your blood sugar levels are higher than normal, but not high enough yet for a diagnosis of type 2 diabetes. It's like your body is giving you one last warning, hey, something's not working right here. In the United States, CDC data shows that more than 96 million adults, more than 1 in 3, have prediabetes. And the scariest part? More than 80% of these people don't even know they have the condition. I'll be straight with you. I see this reality every day in my office. People who could have avoided serious health problems if only they had recognized the early signs. The silent signals your body is sending. Let's talk about these warning signs that many mistake for everyday problems or simply ignore. 1. Unexplained fatigue. Do you feel constantly tired, even after a good night's sleep? This could be one of the first signs that your body is struggling to process glucose properly. The story of my patient Sandra illustrates this well. She was 52 when she came to my office complaining of fatigue that wouldn't go away. Initially, we attributed it to her busy routine as a grandmother of 4. But tests revealed elevated fasting glucose levels, 115 milligrams per deciliter, which firmly placed her in the prediabetes category. 2. Excessive thirst and frequent urination. If you're constantly thirsty, no matter how much fluid you consume, or if you notice you're going to the bathroom much more frequently, your body may be trying to eliminate excess sugar in your blood. 3. Blurry vision. Sudden changes in your vision could be a sign of elevated blood sugar levels affecting the small blood vessels in your eyes. Many of my patients report this symptom, but rarely associate it with prediabetes. 4. Slow healing. Have you noticed that even small cuts and scratches are taking weeks to heal? Elevated blood sugar levels impair your body's natural ability to repair damage. 5. Tingling or numbness. Feelings of tingling or numbness in your hands and feet, known as peripheral neuropathy, can be a sign of nerve damage caused by consistently elevated blood sugar levels. 6. Dark patches on the skin. Acanthosis nigricans, dark, velvety patches especially in the folds of the neck, armpits, or groin, is strongly associated with insulin resistance, the main mechanism behind prediabetes. 7. Recurrent infections, particularly fungal infections, like candidiasis. Elevated blood sugar creates a perfect environment for fungi and bacteria to thrive. 8. Unexplained weight gain, especially around the abdominal area. Insulin resistance can make weight loss difficult and weight gain easier. Let me share another case I followed. Carlos, a 48-year-old executive, came to my office frustrated because, despite having intensified his exercises, he was gaining weight, especially in his belly. He also mentioned, almost as an afterthought, that he had noticed dark patches on his neck, which he attributed to problems with his shirt collar. Tests confirmed prediabetes with very high fasting insulin levels, a clear sign of insulin resistance. Now, here's what many people don't know. You can have prediabetes for years without showing obvious symptoms. That's why the condition is so dangerous. It silently damages your organs, nerves, and blood vessels while you go about your life normally. Why ignoring prediabetes can be fatal. Neglecting prediabetes isn't just dangerous, it can be deadly. Studies published in the Journal of the American Medical Association show that people with prediabetes have a significantly higher risk of developing cardiovascular complications, even before progressing to full type 2 diabetes. Let's talk about what's really at stake. Increased cardiovascular risk. Research from the American Heart Association reveals that prediabetes increases the risk of cardiovascular disease by 50%. This includes heart attacks and strokes that can be fatal or leave permanent damage. Silent kidney damage. Kidneys are particularly vulnerable to the effects of elevated blood sugar levels. Diabetic nephropathy can begin in the pre-diabetic stage, years before a diagnosis of type 2 diabetes. Neurological impairment. Diabetic neuropathy, nerve damage, can start during prediabetes. This can lead to chronic pain, loss of sensation, increasing the risk of undetected injuries, and even dysfunction of internal organs. Irreversible vision problems. Retinopathy, which can lead to blindness, doesn't wait for a full diabetes diagnosis to start developing. Accelerated cognitive decline. Recent studies, including important work published in the New England Journal of Medicine in 2023, have established a link between insulin resistance, the mechanism behind prediabetes, and an increased risk of cognitive decline and dementia. Elevated blood sugar levels can damage brain vessels and promote inflammation that affects brain function. Let me tell you about one of the most impactful cases I've ever treated. Roberto, a 57-year-old university professor, came to see me after suffering a minor stroke. He had no family history of diabetes and considered himself relatively healthy, despite being moderately overweight. Tests showed he had prediabetes for at least 5 years, according to estimates based on specific markers. That small stroke was the result of years of vascular damage caused by elevated blood sugar levels he didn't even know he had. Roberto told me something I've never forgotten. "Dr. Mike, if someone had told me I was walking toward a cliff, I would have changed direction. But nobody warned me, and now I have to live with the consequences." I don't want you to be like Roberto, finding out too late. And that's why, before we continue with information that could literally save your life, do me a favor. If you're learning something new so far, leave a like on this video and subscribe to the channel. Each subscription motivates me to continue bringing this type of content that can make the difference between life and death for many people. And in the comments, tell me, have you experienced any of these symptoms I mentioned? This will help other people realize they're not alone. The numbers that define prediabetes. So you clearly understand if you're in the danger zone, let's talk about the specific numbers that define prediabetes. A fasting blood glucose between 100 and 125 milligrams per deciliter is considered prediabetes. Below 100 milligrams per deciliter is normal, and 126 milligrams per deciliter or above is diabetes. Oral glucose tolerance test, OGTT, between 140 and 199 milligrams per deciliter after 2 hours is prediabetes. 200 milligrams per deciliter or above is diabetes. A glycated hemoglobin, HbA1c, between 5.7% and 6.4% indicates prediabetes. 6.5% or above is diabetes. These values are based on American Diabetes Association, ADA, guidelines and are used internationally as diagnostic parameters. Recently, some researchers have suggested that we should start worrying about even lower levels. A 2022 study published in the journal Diabetes Care showed that people with fasting blood glucose between 90 to 99 mg/dl were already showing early signs of microvascular complications, especially when combined with other risk factors. Who is at higher risk? Certain groups have a significantly higher risk of developing prediabetes. People who are overweight or obese, especially those with fat concentrated in the abdominal region. Visceral fat, that around the organs, is metabolically active and significantly increases insulin resistance. People with family history. If you have first-degree relatives with type 2 diabetes, your risk increases by up to 40%, according to studies by the National Institutes of Health. People over 45. Risk increases with age, although we're seeing an alarming increase in cases in increasingly younger people. Certain ethnic groups: African Americans, Hispanics/Latinos, Native Americans, Asian Americans, and Pacific Islanders have higher rates of prediabetes and diabetes. Women with history of gestational diabetes, or those who gave birth to babies weighing more than 8.8 pounds, 4 kilograms. People with polycystic ovary syndrome, PCOS. This condition is strongly associated with insulin resistance. Sedentary people, those who do physical activity less than 3 times a week. People with sleep apnea. This condition has been increasingly recognized as an independent risk factor for insulin resistance. People with high blood pressure or high cholesterol levels. These are components of metabolic syndrome, often associated with prediabetes. Emily, a 38-year-old patient, came to my office for a routine checkup. She had no specific symptoms, but had all these risk factors: slightly overweight, family history, mother with type 2 diabetes, Hispanic ancestry, and a sedentary lifestyle due to her work as a programmer. Her tests revealed an HbA1c of 6.1%, clearly prediabetes. The scariest part? She could have gone years without knowing, accumulating damage to her organs. Prevention is possible. The DPP study that changed everything. Now, for the good news: prediabetes is reversible. And we have solid scientific data that proves it. The Diabetes Prevention Program, DPP, one of the largest studies ever conducted on diabetes prevention, followed more than 3,200 people with prediabetes for more than 15 years. The results were impressive. The participants who made moderate lifestyle changes, 5 to 7% weight loss and 150 minutes of physical activity per week, reduced their risk of developing type 2 diabetes by an impressive 58%. This benefit was even greater for people over 60, with a 71% risk reduction. Even after 15 years of follow-up, those in the lifestyle change group still had a 27% lower risk of developing diabetes compared to the control group. This means that small changes sustained over time can literally save your life. Proven strategies to reverse prediabetes. Based on the most recent scientific evidence and my clinical experience of more than 20 years, here are the most effective strategies for reversing prediabetes. 1. Adopt an anti-inflammatory diet. Studies show that chronic low-grade inflammation is directly linked to insulin resistance. A diet rich in anti-inflammatory foods can make a significant difference. Prioritize healthy fats, extra virgin olive oil, avocado, nuts, and seeds. A study published in the New England Journal of Medicine showed that the Mediterranean diet, rich in these fats, reduced the risk of developing type 2 diabetes by 52%. Consume lean proteins, fish, skinless chicken, tofu, and legumes. Choose complex carbohydrates, whole grains, vegetables, greens, and fruits with low glycemic index. These foods release glucose more slowly into the bloodstream, avoiding insulin spikes. Increase fiber intake. Aim for 25-30 g daily. Soluble fiber, found in foods like oats, apples, and beans, is particularly beneficial for glycemic control. A study published in The Lancet showed that increasing fiber intake by just 7 g per day, equivalent to a serving of oats, is associated with a 6% reduction in type 2 diabetes risk. Include foods rich in polyphenol, green tea, berries, dark chocolate, above 70% cocoa, and spices like cinnamon and turmeric. Drastically reduce refined sugars and simple carbohydrates. Sodas, sweets, white breads, and refined pastas cause glycemic spikes that exacerbate insulin resistance over time. 2. Prioritize strategic exercise. Physical exercise is a powerful tool against prediabetes, but not all exercises are equally effective. Resistance training. Studies published in Diabetes Care show that weight training increases insulin sensitivity for up to 48 hours after the session, in addition to increasing muscle mass, which is metabolically more active than fat. HIIT, High-intensity interval training. A systematic review published in the British Journal of Sports Medicine concluded that HIIT is superior to continuous moderate-intensity exercise for improving insulin sensitivity in people with prediabetes. Exercise after meals. A walk of just 10 minutes after meals can significantly reduce post-meal glucose spikes, as demonstrated in a study published in Diabetology. A reduction of sedentary behavior. Breaking up long periods of sitting with small active breaks every 30 minutes has been shown to improve glycemic control independent of formal exercise. 3. Optimize your sleep. The relationship between sleep and glucose metabolism is well established. A study published in the Journal of Clinical Endocrinology and Metabolism showed that just one night of partial sleep deprivation, 4 hours instead of 8, can reduce insulin sensitivity by 25%. People with untreated sleep apnea have a significantly higher risk of developing type 2 diabetes, regardless of body weight. Evidence-based recommendations. Prioritize 7 to 8 hours of quality sleep. Maintain regular sleep schedules. Create an environment conducive to sleep, dark, cool, and quiet. Limit screen exposure at least 1 hour before bedtime. Consider screening for sleep apnea if you snore loudly or wake up tired. 4. Manage chronic stress. Chronic stress raises cortisol levels, which increases glucose production by the liver, reduces the ability of cells to absorb glucose, promotes visceral fat accumulation, exacerbating insulin resistance. Proven strategies. Mindfulness meditation. A University of California study showed a 35% reduction in cortisol levels after 8 weeks of regular practice. Deep breathing. Simple breathing exercises, such as 4-7-8 breathing, inhale for 4 seconds, hold for 7, exhale for 8, can activate the parasympathetic nervous system, reducing stress hormones. Yoga combines the benefits of physical activity with stress management techniques. Time in nature. 20 minutes daily in natural environments have been shown to significantly reduce cortisol levels, according to a study published in Frontiers in Psychology. 5. Consider specific supplements. Although I always emphasize that supplements don't replace proper diet and exercise, there are some with solid scientific evidence for improving insulin sensitivity. Magnesium. A study with more than 4,000 participants published in Diabetes Care showed that higher magnesium levels were associated with a 47% lower risk of developing type 2 diabetes. Vitamin D. Low vitamin D levels are consistently associated with a higher risk of insulin resistance. A recent study published in the Journal of Clinical Endocrinology and Metabolism found a 60% reduction in type 2 diabetes risk among people who normalized their vitamin D levels. Berberine. This natural substance has shown efficacy comparable to metformin, a diabetes medication, in some studies, improving insulin sensitivity and reducing blood glucose levels. Chromium. An essential mineral for normal glucose metabolism. A meta-analysis published in Diabetes Care concluded that chromium supplementation may improve glycemic control in some people with diabetes or prediabetes. Alpha-lipoic acid. A potent antioxidant that improves insulin sensitivity and may help prevent diabetes-related complications, as demonstrated in several European studies. Important: always consult a healthcare professional before starting any supplementation, as drug interactions and inadequate dosages can be dangerous. 6. Intermittent fasting protocols. Research on intermittent fasting and insulin resistance is rapidly expanding. A study published in Cell Metabolism showed that 16:8 intermittent fasting, 16 hours fasting, 8 hours eating, significantly improved insulin sensitivity, even without weight loss. Intermittent fasting reduces systemic inflammation and promotes cellular autophagy, processes that improve metabolic function. Evidence-based approaches. A 16:8 method, most suitable for beginners. A 5:2 method, 5 days of normal eating, 2 days of significant caloric restriction. Alternate day fasting. Caution note: intermittent fasting is not appropriate for everyone, especially those with a history of eating disorders, pregnant or breastfeeding women, or those with certain medical conditions. Personalized medical advice is essential. 7. Consider certain medications. In some cases, especially for people at high risk of progression to full type 2 diabetes, medications may be considered. Metformin. The DPP study showed that metformin reduced the risk of developing type 2 diabetes by 31%. It's particularly effective for people with O BMI greater than or equal to 35, O age less than 60 years, O history of gestational diabetes, O very high fasting glucose levels, GLP-1 receptor agonists. Newer medications like semaglutide, Ozempic, are showing promising results in preventing progression from prediabetes to type 2 diabetes, plus benefits for weight loss and cardiovascular protection. These medications should be discussed individually with your doctor, as they have specific benefits and risks. Real transformation stories. Let me share a few more real stories that demonstrate that reversing prediabetes is not only possible but often simpler than people imagine. The case of Michael, 62. Michael came to my office after his family doctor had detected elevated blood sugar levels, HbA1c of 6.3%. He had a prominent belly, despite not being extremely obese, and suffered from untreated sleep apnea. His biggest concern was his memory, which was beginning to fail. We implemented an approach focused on 1. Testing and treatment for sleep apnea. 2. Mediterranean diet focusing on healthy fats and reducing refined carbohydrates. 3. Short walks after each main meal. 4. Vitamin D supplementation. His levels were very low. After 6 months, his HbA1c dropped to 5.5%, out of the prediabetes range. He lost 20 pounds, 9 kilograms, mainly in the abdominal region. A sleep apnea improved significantly. And most important to him, he reported substantial improvement in mental clarity and memory. The case of Mary, 44. Mary, a marketing executive, frequently worked late, ate out almost every day, and had high stress levels. Her routine checkup showed fasting blood glucose of 118 milligrams per deciliter and a concerning pattern of visceral fat, despite not being significantly overweight. Her personalized plan included 1. Stress management techniques, including structured diaphragmatic breathing 3x daily. 2. 14-10 intermittent fasting protocol, adapted to her work routine. 3. Replacing processed snacks with protein-rich and healthy fat alternatives. 4. HIIT twice a week and yoga once a week. In just 3 months, a fasting blood glucose normalized to 92 milligrams per deciliter. 11% reduction in visceral fat, measured by bioimpedance. A significant improvement in inflammation markers. A reported more stable energy levels throughout the day and better sleep quality. The case of Paul, 55. Paul, a truck driver, had multiple risk factors: severe obesity, strong family history of diabetes, high blood pressure, and sleep apnea. His HbA1c was 6.2%, and he was about to start diabetes medication. The challenge was to adapt interventions to his on-the-road lifestyle. We developed a plan that included 1. Preparation of healthy meals that could be taken on his trips. 2. Resistance exercises that could be done with elastic bands anywhere. 3. Structured protocol to break up long periods sitting at the wheel. 4. Magnesium and berberine supplementation. 5. Using an app for glucose and exercise monitoring. Results after 1 year. A HbA1c reduced to 5.6%, borderline, but out of the prediabetes range. 40 pound, 18 kilograms, weight loss. A normalized blood pressure. It didn't need to start medication for diabetes or hypertension. These stories illustrate a crucial point. There's no one-size-fits-all approach. Success comes from personalized strategies that adapt to each person's unique realities. Friends, today we talked about a subject that can literally save lives. Prediabetes is a silent condition that affects millions of people, but it offers a precious window of opportunity for intervention. The signs are there: unexplained fatigue, excessive thirst, slow healing, tingling in the extremities. And the risks of ignoring them are serious: heart disease, strokes, kidney damage, vision problems, and cognitive decline. But as we saw in the stories of Michael, Mary, and Paul, reversal is possible with the right strategies. An anti-inflammatory diet, a strategic exercise, a sleep optimization, a stress management, a specific supplements when needed, a intermittent fasting protocols for some, and in certain cases, medications like metformin. And most importantly, the sooner you act, the easier it will be to reverse the process. If you recognized any of the symptoms we discussed today, or if you identify with the risk factors, don't wait. Schedule an appointment with your doctor and specifically ask for prediabetes tests, fasting blood glucose, glycated hemoglobin, HbA1c, and, ideally, an oral glucose tolerance test. Knowledge is power, but action is transformation. This is Dr. Mike, reminding you that your health is literally in your hands. See you in the next video, where we'll talk about another crucial topic for your well-being. And don't forget to like, subscribe to the channel, and share this video with someone you believe needs to hear this message. After all, you might be saving a life. Until next time.